If you're starting your internship soon, but you don't know how to prepare yourself for the position, well, I guess this is the video for you. So I have only like 2 days left in my internship. I didn't do the 5th video, but here I am doing it. So let's cut the chase and get into the science of it. We are all familiar with the document that the sociologist Stevenson has all the information about the internship, the rules, regulations, and the things that we can do and not do, so everything is there. And it has stated clearly that the internship position is not an educational position, but it's a position that is there to assess the suitability of the doctors in terms of their clinical reasoning skills and also how we deal with patients and also with other colleagues. So this creates an added pressure for us that we kind of need to know all, and we train ourselves by ourselves. But I have tried to come up with a system in order to be able to educate ourselves before or even during the internship. So let's get to it. Most doctors, when they start their internship, they usually start at the primary healthcare centers. And the way of thinking about the patients that we see are usually divided into two categories. So you will be seeing acute patients and non-acute patients, and both of them need a kind of different type of reasoning and a kind of different type of thinking and approach. So for the acute patients, it will mostly be patients that might have an infection, whether it's a respiratory tract, urinary tract, or other type of symptoms coming in terms of headache, chest pain, shortness of breath, dizziness, and all the workup that goes with it. And the idea becomes here with acute patients, what can I do here and now, or should I preserve my patient at the primary healthcare center, or they are ill enough to be sent to the emergency department. So this is the main idea of acute patients. And the way that I usually prepare myself for such patients is to understand the differential diagnosis that I need to investigate that patient for. And in order to do that, I prepare myself using a platform that is called Online Medit. So you go to Online Medit, you create an account, and the videos are for free. You go to clinical, then methods. And in these methods, in the intern program, it teaches you how to think in a broad way in different differential diagnoses and to make a workup for your patient. So this is one. And then the second type of patients, they are non-acute patients that have something chronic or you need to investigate it. So the types of chronic things that they have can be heart hypertension, diabetes, dyslipidemia, heart failure, pain management. Pain management, especially in the age group of 75 and plus, it becomes really important, especially that they might have other comorbidities and you need to kind of adjust their medications. So this is on one hand, and on the other hand, how to work up lower back pain, hip pain, knee pain, all these approaches. And in order to understand my approach to these things, I usually use Medibus. So yes, there are different websites that you can use, but I usually prefer Medibus, and that will be for 4 reasons. So the first reason is it is divided in terms of diseases and symptomatology. So even if I know the symptom, but I'm not sure about the differential diagnosis, it helps me to brainstorm a bit more and see if I'm missing something. And the second thing is, it has divided its history taking and physical examination in a way that it helps me to find the right Swedish terminology for each one of them, especially when I want to explain a physical finding, but I'm not finding the Swedish word. So it really helps me in order to do that. And the third thing is, when I order a lab investigation, it comes back and I kind of want to know how to interpret that. It's also easily navigated through Medibus. And the fourth thing, and which is the most fun thing, it also contains Cochrane systematic reviews and how it kind of compares different researches, different guidelines from different like societies and systems. It really is fun just to understand how different scientific societies think or how different researches show something. So for most of us that have our education outside Sweden, we are affiliate to Umeå University. So if you have an Umeå ID, you can have a free account and access in Medibus. So this is about Medibus, and if I want to understand what are the rules and the regulations that happen in the hospital, so this is where I kind of read about internet medicine, which is really good. So this was one type of patient. Another type of patients, if they are coming in with the symptomatology, then I ask myself, is it a malignancy? Should I investigate a malignancy? So the healthcare system has created a program which is called the SVF, Standardized Vård Förlopp, which is kind of fast track of referrals between the primary healthcare and also the hospital, so that these patients become investigated in a fast way. And in order to be able to best manage these patients, it's really important to understand what the SVF criteria is. And in order to do that, there is a website for it, which is called the cancercentrum.se, and it has the Kunskapsbanken there, and you have all the programs of the different diseases. For example, prostate cancer, breast cancer, colon cancer, and all the other things, leukemia, yeah, you name it. But I kind of go back to the Medibus because it's kind of like has shortened everything in one place. The third type of patients, it might be psychiatric patients, and it's really important to understand how to be able to talk to a patient that is suffering from depression, generalized anxiety disorder, of panic disorders, or it's that person comes in because they are worried if that they have a type of a disease, and the only thing that you need to do is a reassurance. So these are the way that I have prepared myself. And also a very good way to prepare for the internship is via doing the AT questions that are found in the Karolinska Institute website. So the thing about AT, when we get our license, we need to be at the same level of knowledge, skill as compared to someone that has gone through the AT. And AT is an educational position. So doing the AT questions, it really helps in understanding the guidelines, and also helps in doing like an active recall and repetition about the different diseases. And it has really nice scenarios. So I really encourage that every single day you go through one case or one question of the AT. So if you are starting your internship, these are the things that I really recommend. You go on, watch the intern content on Online Medit, start reading about the different types of diseases that I just mentioned, and most importantly, yes, it's not an educational position, but you can do it. I have also attached a link in the Dropbox that you can download like a short version of all the things that I have talked about, and also the different topics or the different diseases that are most common in the primary healthcare center, so that before you start your internship, you can go and read about them and be prepared, and you kind of rock your internship.